Okay, so everybody should be able to see my screen right now. You should be able to see me. I can't see you and I can't hear you for now. But like I said, I will stop and I will be able to ask you questions and we will have the time to communicate. Remember, after 40 minutes, I'll give you the little warning, but we will maybe possibly cut out. If we do, we'll just rejoin with exactly the same access. All right. Remember also after today, this is recorded, so you will get a link with an email after we are finished today, sending you all the information for today. We'll share a PDF version of the documents that I've used or the presentation that you see in front of you. We will also send you a link to a private YouTube channel where you'll be able to view and review this recording as many times as you like. Okay, and then you will also be sent your certificate, your virtual certificate, which is amazing. And then remember, you all get a gift, and your gift will be sent with your next salon order. Okay, right. So we're going to begin. Every now and again, I just have to let people in, but they are all in for now. So we're all good, and we can officially begin. So yes, it's different, right? This is strange, it's weird, it's different, but it's super exciting at the same time. And I think that what we have got going here is something that is interesting, very interesting. And obviously, as you know, today's topic is all about anti-aging. So I'm going to take you through a couple of things with anti-aging and particularly share with you caviar and density. And I think that is going to be very, very informative in helping you as well in the future with your virtual consultations. So let's get going. Okay. Sorry, I'm just having problems here. Ah, there we go. Okay, so we see our pretty little old lady, and I think that she really exudes a little bit of fun and a little bit of happiness. So I thought I'd add some cheerfulness into different stages that we're finding ourselves in at the moment. So exactly what we are going to cover today. Let's have a look at that. So first of all, we're going to look at what is aging. Now, the biggest aim of today's class is to reinstall should I say, all your knowledge that you have learned through the past. So when you studied, some of us studied many moons ago. Some of us studied a couple of months ago. All right, so things change as well, but a lot of things really do stay the same. And a lot of important anti-aging factors are there. It doesn't matter when we last studied, but it's important to go back and to recap and to rethink of those things. So I want to make today's class easy, simple to understand, and help you to assist and help you with your analyzing. Obviously, when we do eventually open, who knows when that will be, but when we do open, but at the same time as well, virtually while you are busy. Okay, so this is what today is all about. I want it to be practical, if that makes sense, things that are easy to understand and things that flow and things that you will remember. So we're going to go through, first of all, just a simple definition of what is aging. We will also look at the different types of aging, two particular types in particular, and then we will also look at the different visual appearances that these two have. Okay, then we will look at your structural differences between your young and your mature skin, cross-section, exactly what is happening in the skin, phases of wrinkle formation, so 3 different phases. And then we will also look at the stages of an aging face. So what happens in our 20s and 30s? What happens in our 40s, 50s, 60s, 70s plus? How does the skin actually physically change? And then last but definitely not least, we will be talking about the relevant retail products. So in particular, caviar, density, and then also have included global eyes for us. Okay. And then you will be finished. So what is skin aging? So if we look by definition, aging is a process of becoming older. I think we're all pretty much clued up on that. And sadly, it's going to happen to all of us. But excitingly, what we can do is we can look at how we can slow this process down. So it is linked to the life of a single cell within an organism which ceases to divide. In other words, what is happening in our basal layer of our skin is that cellular division actually ceases to happen. It stops. So first it slows down, and then eventually it will stop. And that is where we actually have the aging process beginning. So if we look at the types of aging on our skin, so I'm sure most of you have seen these two words before, intrinsic and extrinsic. Now, what do they mean? So intrinsic aging is, I always like to think of it very, very simply. The I is for internal and the E in extrinsic is for external. So what it means is intrinsic aging is all of our internal aging. And this is referred to as chronological aging. All right, it is a natural aging process. It happens, it's genetic, so there's also nothing we can do about it. Genes control how well we age, and this is not the genes that we wear. This is the genes in our DNA, all right. And it accounts for approximately 10% of our total age. Now, if you have a look at your mom or your granny or an aunt or a sister, you've got a good indication of how well you are possibly going to age, or how well or how bad you could possibly look, right? Things like external factors in the extrinsic will make up the difference, but we're going to get to that now. So everyone ages, but the genes control how quickly this process is going to unfold. And a good skincare routine is extremely beneficial to slow down this aging process. So over time, you are going to notice that the attributes of your facial skin will change. And if we learn more about the process like we are going to do today, we can slow down that process. We can make better decisions on how we can look at our daily skincare routines. And then most importantly, with us being therapists, we can look at how we can advise our clients on how to change not only their routines, but also how their lifestyles are going to affect the aging and what simple changes they can make to their lifestyles to help with the extrinsic parts of aging. So if we look at extrinsic aging, it is also referred to as photo aging. So this is lifestyle, external aging. It's basically what happens to the body from the outside contributes to how the skin is going to age. And this sadly causes between 80 to 90% of our aging. So I know we have all been dying for alcohol and cigarettes and all of that in our lockdown process. And I'd love to be able to see your faces right now with like some little smiles and some little twinkles. But that's been really bad. Well, that is bad for our skin, as we do know. Okay, so our external factors that we've got that influence aging are things like pollution, smoking, alcohol, sun, facial expressions, sleeping positions, gravity, and obviously your incorrect product use. So if we have a look at one or two things there, like sleeping positions, why would a sleeping position affect the way in which we age? And that would be because it would be generally we find comfort in a certain position when we're sleeping. So if you are sleeping and, for example, you always cross your hands over your chest and something like that, you could cause deep lines within your breast tissue, in your clavicle and your décolleté area, because it's a constant movement or a constant, impression, if you can look, if you think about it this way. Facial expressions as well. So if you always frown and you always cross and you always got one of those facial expressions, it will be expression lines that will eventually become deep wrinkles. So that is part of our external factors. So we need to be conscious of how and the way we look and the way we express ourselves always. Don't be expressionless. As you know me, I've always got expressions on my face. And hey, it's going to lead to wrinkles, but I also like people to see my personality, okay, through the facial expressions. But it's just little simple things like that that obviously do contribute to the external part of aging. So it's intrinsic extrinsic. Your intrinsic is your internal, accounts for only 10%, and it's your natural aging process. And then you've got your extrinsic, which is your external aging, lifestyle aging, accounts for 90%. And a lot of our lifestyle factors affect your thing. Just hold on for me quickly. We're just looking at a security thing, but we're all good. Okay, sorry about that. These things happen. Okay, good. All right, so next thing that we're going to look at is the different visual appearances. Now, your different visual appearances is when we again look at intrinsic and we look at extrinsic, they're going to visually appear to be different. So somebody who is aging intrinsically, you're going to see certain things. For example, you're going to see a thing like a loss or a natural aging process, but you're going to see a loss of collagen and elastin production. So that's going to mean there that your skin is going to lose its density. It's going to come a little bit soft. It's going to start to have sort of indentations in it. Okay. The cell renewal process is going to slow down. Now, it's not something that you can visually see, but it's something that you can feel. And this is going to be like a rough picture on the surface of the skin. You're going to have more dead skin cells. The skin is going to become thin and transparent. And we're going to have a loss of fat. So you'll see that the fat starts to move away from the bone. We lose it, it moves to other areas through menopause process. And then we are going to have more hollow structures. So intrinsically, these are the conditions that you will see on the skin, and they are a natural process that will always happen to everybody. Okay. The skin will also naturally become drier as we get older. And our hair, unfortunately, will go gray. Our nails might either, and sometimes this can go in two ways. The nail plate can become thin and brittle, but in some cases, it can also go very thick, almost calcify and go hard. So it can happen in either way. Right. If we look at extrinsic, we'll be looking at a couple of different processes that are going to be happening here, or visual appearances that you're going to see. And these are things like pigmentation. So when you are looking at a skin and you are trying to figure out whether it's an intrinsic or an extrinsic factor, this is where your comparison is going to come into play. You're going to look at things like age spots. You're also going to look at things like spider veins. Spider veins is generally an indication of too much sun exposure or smoking or alcohol particularly, or a lot of spicy foods. Rough, leathery skin. So here you're going to have that like an indentation, but it's thick, it's leathery, it's almost hard to the touch. You're going to have a lot of loose skin, all right, and the complexion could possibly be quite blotchy, can also be dull. And then things like skin cancer, basal cell carcinomas, those are things that could come up possibly that are caused by overexposure to the sun damage, or poor, maybe like rubbing of items of clothing on a particular area over and over and over again, which stimulates cellular growth, and that could be bad cellular growth, like in the case of skin cancer. There are a few contributing factors there. So natural aging, we're looking at things that are happening internally that are out of our control. Extrinsic factors, we are looking at others that can have or that are more in our control. So things like applying sunscreen, having the right skincare routine for your skin type will help slow down the extrinsic aging factors. Okay. So if we have to go into a little bit more depth in structural differences between a young and an old skin. Remember, the skin has got its three layers. It's epidermis, it's dermis, and it's hypodermis. Now, in between the epidermis and the dermis, there is something called an epidermal-dermal junction. This is basically where the epidermis, the last layer of the epidermis, meets the start of the dermis. And in that section, this is like your mechanical support section. So if you think of anything underneath that that epidermal dermal junction, if it loses its density, you're going to have like a sag in the skin. I hope you can all see my pictures, my images of my hand. Just want to glance at Kirsty's screen to see if you can see. Yeah, you can pretty much see it. Okay, so let's have a look at what we're looking at. So a young skin, if you look at the image in front of you, you're going to see the dermis, all right, the epidermis, which is at the top. Then you're going to see like a white sort of kind of thicker layer. That's your epidermal dermal junction. And then underneath, you're going to see a whole bunch of filaments, and these are your type 4 collagens. Okay. So basically what is happening structurally when you are aging, and if we now compare it to a mature skin, it now becomes easier to see the differences. So I want to draw your attention to, first of all, the filaments underneath. You can see on the mature skin side, you'll see that your filaments are slightly far and few between, so they've become less. If you compare it to the younger skin on the left, you'll also see that the epidermis thins slightly. So that white line where the curves are, you will see there that the thickness is not the same. That is the natural thinning process of what is happening on the epidermis of the skin. And then you will also see under the mature skin in comparison to the young skin, you will see more corrugation in the mature skin, deeper corrugation lines. Okay. So visibly what is happening is on the epidermis, the changes that are happening is the slower cellular renewal rate. You'll also visibly be able to see a change in pigmentation, all right, and color of the skin. There can definitely possibly also be changes in sensitivity. Hence, a moisturizer like Time Balance out of Densité, which is particularly going to help with things like a change in sensitivity levels, particularly when you're possibly going through menopause, when a lot of these changes are actually, happening. You'll also see that the skin is going to look sallow, blotchy, dull, and gray. So these are what we are going to see on the epidermis of an aging skin. Whether it be intrinsic or extrinsic, we are going to see changes. Okay. Then you are also going to see in your epidermal dermal junction, all right, there you're going to see over time, it's going to flatten, it's going to get thinner, and there is a disruption in the communication, all right, between the cells. And here you're also going to see a loss of your anchoring filaments and your type 4 collagen, which is a nice tight collagen that normally keeps the skin young, supple, and able to constrict and dilate, have movement and spring back into place. So when we age, these anchoring filaments are going to be depleted, and it's going to alter the cellular communication between your epidermis and your dermis. So it's going to weaken the structure of the skin. As you can see, then we're going to get more wrinkles. The skin is going to appear sagging. And that's what you can see in your images in front of you. You'll also then notice in the dermis, we're going to have a breakdown of your dermal tissues, which is your loss of your collagen and your elastin. What you're also going to happen in the dermis is there's going to be a slowdown of blood circulation. Now, blood circulation that slows down, all right, is if we have a slowdown in blood circulation, we're going to have less oxygen and nutrients that are coming to the surface of the skin. And that's why you're going to see a change in color, the dull, sallow, blotchy, gray looking skin. And that's because we have lost the blood circulation, or that the blood circulation has slowed down to the surface of the skin. And then in the hypodermis, this is where we're going to have a loss of fat. Now, your subcutaneous tissue, your fat, this is where we're going to be ending up with hollow structures in the skin. The hollow structures are going to happen because the fat is going to lose its density. During the menopause process, fat moves away from areas like the face and all of that and moves to areas like the abdomen. It also gets less and less. The bones also shrink. So what happens is your bones shrink as you get older. We lose fat, and that's where you get the very heavy sagging skin, because the bones are shrinking away from the attachments of the skin and the fat to the bone. And that's where we're left with a very, very heavy sagging Okay, we're hoping this is only going to happen in our 70s, but it does unfortunately go, or it is unfortunately going to happen. And that happens, that's a hypodermal change. Okay, so we have changes in summary happening in the epidermis of the skin, in the dermis, and in the hypodermis. All right, in the epidermis, remember slow cellular renewal rate. And this is where I want to share something with you. That's why exfoliation is so important. And also why using a toner attached to a cotton pad or a piece of gauze is also important as you start to mature. Because that contact between exfoliator and also even a cotton pad and a piece of gauze when you're wiping over the face, that contact onto the skin is constantly going to help and to assist to improve the cellular renewal rate by removing the dead skin cells, stimulating circulation and blood to help with the skin not looking so dull and so gray and so sallow. Okay, so those are little tips that really, really, really do help. All right, so moving on, we are going to look at different phases of our wrinkle formation. So obviously a wrinkle starts somewhere, okay? Sadly, yes, and these even start to happen in our 20s, which I'm not in anymore, unfortunately, and haven't been for a while. But these start to happen already, and our wrinkles start with fine lines, okay? And often fine lines start with dehydration. So it is extremely important as an anti-age prevention to make sure that your skin is hydrated. If your skin is well hydrated and plump, it's going to lead to less fine lines, which eventually will mean hopefully less wrinkles. Okay, so we go in 3 different phases. We start with a fine line. Your fine lines eventually then become slightly deeper. They become more permanent. They can even be your expression lines. Okay. And then after your expression lines, you're then going to have your deep wrinkles. Awesome. By the way, our meeting has been upgraded, so we are not going to cut out after 40 minutes, which is awesome. Yay, I'm very happy. Okay, so don't leave us after 40 minutes, please. All right, okay, so fine lines, expression lines, and then we have got deep wrinkles. Now, what happens in our fine line category? Like I said, it starts out with dehydration, and that dehydration eventually is going to lead to be slightly deeper. So your fine lines are going to be thin and they're going to be shallow, as you can see in the image, taken just underneath the eye. And most of us have this in our 20s, mid-20s to early 30s, even middle 30s. Some of us are even fortunate, not me yet, but some of us even only have this in our 40s, which is amazing. Okay, good skincare routine, I'm sure, and I'm sure it's because you've been using it. All right, so that happens. Then it leads to expression lines. Now, this is a little bit of an exaggerated image because you can see that the gentleman is actually smiling. And by the way, you'll also see in my images, I've used both male, female, and I've also used different ethnic groups when you look at the images that I'll show you a little bit later. And I'm going to explain a little bit about that too, all right, just now. But your expression lines, so when you start to smile a lot or you frown a lot, whatever it might be, this is a repetitive muscle traction, okay? And it will gradually widen and widen and widen. And as you start to lose collagen and elastin fibers beneath the dermis, you lose the ability to stretch and to recoil very easily and very quickly. And that's where those will eventually become deep wrinkles. Inevitably, if we look at the last image, they will eventually become very, very deep wrinkles, very definite, because the skin does not have the ability to stretch and to recoil. Okay, so I want to quickly just explain something to you. First of all, I want you to think of your collagen and your elastin fibers like a rubber band, an elastic band, okay? And I think some of you have heard me explain this, but it is so important to understand this concept. And this is exactly how our collagen and our elastin fibers in the dermis work. And they are crucial when it comes to the aging process. And that's why nourishment and hydration are 2 of the key preventative factors when we are treating or trying to slow down the aging process. we need to ensure we have enough water and enough oils, okay? And how it works is, if this is my elastic band and I leave it outside in the sun every day, and it gets beaten by the sun and the wind and the rain and the elements, and an insect will walk past it and crawl over it, and then a cat will come and it will walk past it and it gets stuck, and you know, it just gets dragged around the garden. When I go and eventually pick up that elastic band, the minute I take it and I try and move it and I try and stretch it, it's just going to snap, okay? However, if I took that same elastic band, I put it in a beautiful little box, and I protected it every day, and every night I took out and I massaged a little bit of oil on it, and I gave it a few little exercises here or there to keep it nice and supple, and I put it back in its box every day, and I put it in a cool, warm place, and I really, really cared for it and looked after it. Can you imagine me looking after elastic band as a pet? Okay. If I did that, you'll be able to see when I took out that elastic band out of its box after a month, when I pick it up and stretch it, it's going to stretch and it's going to be in good condition. It's going to recoil. It's not going to have its fraying edges. It's not going to have cracks in the elastic band. And that's how we are supposed to, and we should, look after our skin, okay, with the same care and the same nourishment. Now, I know I'm speaking to the converted already, hence we are all in this chat room, and we are also all therapists, and we all do generally have good skincare routines, I'm sure. Remember, not all of our clients do, and at the end of the day, our job as therapists is to convey the message to our clients, okay? So skin nourishment and hydration is very, very important when slowing down the aging process. And then the last topic that I want to bring up is different aging groups, not different aging groups, different ethnic groups. Okay, so there are a couple of reasons why your white Caucasian skins will age faster, first of all, than the men, and second of all, faster than your black African skins, okay? And the reason for that being is structurally there are a couple of differences. Structurally, in an ethnic skin, the epidermis is thicker, there is more melanin, and that prevents against sun damage. There is also collagen and elastin fibers that are more lubricated because an ethnic skin contains more oil and sebaceous glands. So the more natural oil that's present in the skin, the more lubricated the collagen and elastin fibers are, the slower the aging process. Also, the more protection they have against our external factors. Right. Men kind of fall somewhere in between. So men can age slower than women because they also have a thicker epidermis. However, men often don't look after their skin. So often what you're going to see on a male skin is a lot of extrinsic aging factors. So as men get older, they will generally have a lot more pigmentation, they'll have a lot more expression lines and deeper wrinkles than ladies. And that's purely because they do not look after their skin the same way in the way ladies do. Right. So I hope that is interesting for you. I'm going to stop. I'm going to look at the chat, and I just want to see if there are any questions. If there are any questions in the chat, you can pop it up if you're too scared to speak, but otherwise, I'm just going to check on you quickly. Okay. Yes. Are there any questions? You can unmute your mic if you would like, if there are any questions. Is there anything that you would like to add? Is there anything that you're unsure of? Do you like what you see? Is it interesting? Come, Sunaya, I can see you've got something to say. Unmute your mic for us. Okay, I've got a thumbs up. By the way, there's some cool features. You'll see a little reaction button at the bottom there. If you want to put a thumbs up, you're welcome to put a little thumbs up. I don't know what other features they've got in that section. And I'm also just going to, so Sunaya, I see you've unmuted.
I'm
What
all
would you
good,
like to
thank
share?
you.
You enjoying?
All good.
Good,
Thank
is it
you.
helpful?
Yeah.
Excellent. Okay, anybody else? Elise is clapping for us, thank you. We've had a few others, awesome. So everyone's good, I'm going to continue. So. Okay, so I'm back. All right. So we're going to have a look at our next thing, and this is the stages of an aging face. All right. So in the different stages of an aging face, different things are going to happen. All right. So we're going to look at stage 1. We don't really talk about anybody younger than 25 when it comes to aging, because generally, if there is any signs of aging on that skin that is younger than 25, it's most definitely an extrinsic aging factor. It's not an internal aging that is happening, right? But on our age groups between 25 and 35, there are a couple of changes, okay, that happen. So in our 20s to our 30s, skin is voluptuous. It has got volume. It is nice and plump. Okay, it's all still there. It springs back into place very easily. There might be a few early signs of aging, and this would be if we think back to our 3 phases of wrinkle formation. We're most likely looking there at our fine lines starting to appear, and often the cause is dehydration. All right. There will be lines with normal facial expression. So all of a sudden, if I smile or if I laugh or if I frown or something along those lines, you're going to start to see lines that are forming. In the later stages, they become deeper and more prominent. Okay. Generally, in the ages of 25 to 35, the condition is there, but it will disappear when the facial expression is changed. Okay. There is going to be a slight slowdown of the production of collagen. This is more entering the 30, 35s. And that's where, when we look at Matisse's structure of product recommendation, we would look here at our what is soon going to be called our preventative range, but what we currently know as our youth response range. And that is where this age group, youth response, covers clients between the ages of 20 to 40 years. Something like your Avantage moisturizers for normal to combination and normal to dry. This would be your start of your preventative anti-aging products. And we always recommend that your Avantages would start approximately from 30 to 35 to 40 years of age. It's your introduction of your anti-aging preventative moisturizers, okay? And that would be to assist with the slowing down of the collagen and the elastin. It would also help with the plumpiness because it's very nutritious and it is also very hydrating. Okay. You would also look at products like your corrective range, your hyaluronic performance moisturizer, and also your performance corrective serum. Okay, those would be what would fall into that category as to help with your prevention, right? Your skin quality is going to slightly deteriorate. So you might see after a very heavy night out of partying or drinking or who knows what we still get up to. I mean, all things fly at the moment. And you will see like the next day, you'll all of a sudden look at your skin and be like, oh, I never looked this old and when I partied in my 20s. Now look at me. I'm in my 30s and after a heavy night, look what my skin looks like. Unfortunately, the skin quality is going to slightly deteriorate. These are very minimal, but it is starting to happen. And also, unfortunately, the complexion will start to lose a little bit of radiance. So adding our latent products like your Radiance Cream and your Radiance Serum in combination with your Avantages and your Performance Correcting Serum, for example, out of Corrective Range, that would make an amazing combination to treat somebody in the ages or between the ages of 25 and 35. Obviously, bearing in mind they've got no other main concerns, right? We move into the age group that unfortunately I now found myself in, and that is the age group of 35 to 45 years of age. Okay. And in this age group and in this stage, we're starting to see visible fine lines that appear on the forehead, around the eyes. And it doesn't matter in what way you look in the mirror, they are still there, okay? They get more prominent when you do a facial expression, but they are there. And these fine lines appear from, just repetitive types of movement and also dehydration again, that kind of stick there. All right, it's also on the areas of the face where the skin is the thinnest, the forehead, the sides of the eyes, the actual eyelids, the chin sometimes. Those are the areas where skin is quite thin. Then also nasolabial fold. Obviously, this is this area here on sides of the nose. And this becomes a little bit more developed because you start to lose a little bit of volume in the cheeks. And with a loss of volume in the cheeks, you're going to have a slight drag, and that is going to lead to the nasolabial fold, wrinkles starting to develop. Okay. You also might have early signs of lines appearing on the sides and the outer areas of the lips, and the chin begins to lose a little bit of volume as well. If you are a smoker or even a vapor, you will start to see your lines on the sides will be more prominent, okay, and they will appear earlier because of that repetitive smoking factor. So unfortunately, not only is it going to contribute and deteriorate your COVID health, but it's also going to lead to wrinkles. Okay. Under the eye area, you are generally going to find some darkening of the eye areas. I equate mine to a lack of sleep with my two small children. That's what I try and keep telling myself. Don't worry, Lisa, the minute you start getting your 8 hours of sleep again, all of this will go away. But yet when I look at this and I go into detail, I'm thinking, maybe it won't go away. And that saddens me a little bit. All right. So yes, unfortunately, though, it is a natural process that is going to happen. Some of us might start to notice bags underneath the eye. You might never have had them before. Now, all of a sudden, you start. If it's not a systemic problem or a circulatory problem, it just could be part of your natural aging, the aging process that is happening. Okay. Fine lines and wrinkles obviously will develop around the eyes, not only the forehead, but you will get extras and more. And then you will also see that the nasolabial, remember the nasolabial fold will cause thing, but then you will also start to see that will be because of the cheeks that are sagging, and they might lose a little bit of volume. So as you age, you might naturally get that chiseled cheekbone, but then you're going to have the loose and sagging skin on the lower jaw area. That is going to happen. Sounds so terrible, but it's going to happen. But with Matisse, we can slow down this process. Okay. So if we look at our next category, all right, and that is particularly where today's products are going to be focused at, because the rest in your 20s and in your 30s is mostly preventative anti-aging. But when we're looking in our 45s and our 60s and even our 70s, we look at actively repairing. Okay, so yes, there's certain damage that is being done, and prevention most definitely is better than cure. But we can also help the people in this category by reinstilling and re-stimulating collagen and elastin via things like Olay-Signs, for example. So there is hope, all right. So if we look at stage 3 and we look at this age group, 45 to 60 years of age, it's quite a wide age group, but a lot happens between your 45 years and your 60 years of age. A lot of people go through menopause in that stage. A lot of extrinsic aging factors start to appear. You never had pigmentation. Now all of a sudden you've got pigmentation. It's all things that are starting to happen from the external factors that are contributed. So we are going to start to see visible wrinkles on the entire face, even when the skin is at rest. Okay, not everybody, but for most people. Okay, The skin is going to lose its elasticity, or it's going to become loose around the eyes, also on top of the eyes. Okay, so your eyelids might start to hang a little bit as well, and probably bags underneath the eyes, or prominent dark rings can also happen. There is going to be a general significant loss in volume. All right. There will also be the loss of elastin, causing further development of fine lines and wrinkles on other areas of the face. Okay. And then your facial contours will change. And this is because, remember, I said to you earlier, the bones start to shrink. The skin starts to when I mean detach, it doesn't get loose, but it starts to draw out, and you will have a change in your facial shape. Obviously, part of the aging process, but also what you look like in your 20s is not what you structurally will maybe look like in your 60s because of the bone density changes that happen. Then you'll also see that the nose starts to appear to hang a little bit, like maybe the tip goes down with like the pull of gravity. And also, sadly, the nose apparently never stops growing. So that's also not great. Okay. And then the skin texture is denser and hardened. So unfortunately, as you get, especially if you've had sun damage. So for some people, the skin is going to get considerably thinner and looser. But for others, it's going to become a little bit more dense and a little bit hardened and feel thicker. It depends with how much damage you've had. Okay. External factors will contribute to a hardening, but intrinsic aging will be a natural thinning. You'd think it would even itself out, but sadly it doesn't work like that. And we're always left with the worst. Okay. And then collagen production is significantly reduced, and therefore we have a total loss of collagen from the ages of 60 plus. Okay, so the only collagen that we then have is what we put in via products or procedures or injections or something like that. But from 70 plus, unfortunately, there is a total loss of your collagen. And then last but not least, your stage 4, obviously your very deep prominent lines and wrinkles are visible all over the face. Forehead, eyes, nasolabial folds, the cheeks are going to sag. There'll be deep lines and wrinkles around the mouth. The upper and the lower eyelids will hang considerably, making makeup application quite difficult. There will be visible sagging on the cheeks. Your sun damage, yes, it will show up in other stages as well, but now you will see noticeable dark spots and pictures. You'll also see it from my poor little granny that is on my page just now. You will see her prominent pigmentation marks from her sun exposure. Okay. And then obviously you will have a collection of wrinkles that will be crisscrossed, they will be intertwined, they will link over each other, and they will be very, very prominent in your high movement areas around the mouth, the eyes, and the forehead, and then often down the neck and the décolleté. And just talking about the neck and the décolleté for a moment, obviously your neck and your décolleté have, your neck particularly has no sebaceous glands, no oil glands. Your décolleté does, but fewer than the face. And obviously, again, going back to my elastic band story, would be if you are not adding in a lot of oil and nourishment and moisture to the neck and the décolleté, those areas are going to age very, very fast, and sometimes a lot faster than the face. People often protect the face, but they forget about the neck and the décolleté. So it is extremely important to extend your skincare routine, particularly when we're talking about preventative aging, as well as repairing aging, to extend it down to the neck and the décolleté. Right. You don't want to have this beautiful, young, chiseled face, and you've got this loose, creepy neck and décolleté. So make sure you do that whole section. All right. Good. Are there any questions on the chat section? Are we happy? Okay. Some have added some nice comments. So yes, yeah. Unfortunately, the sad reality about an aging class is that we are all going to get there. But I do believe that we are going to get there very gracefully, and especially with Matisse. I have no doubt about that. Okay. All right, so we are going to move into the next section, and we are going to look here, obviously, at our products, okay? Our retail products particularly. And this is really where we are going to talk extensively about the product. And so nice, in front of me, I have the new products and the new packaging, all right, which is super cool. Sorry that you can't feel it and see it for yourself, but when you order it, you'll be able to see it. It's amazing. Okay, and I'll be going through that a little bit with you. I also just want to inform you that I'm going to not be going through every single active ingredient on every single product with an extensive, with an extensive explanation on each. Remember, some of you have already had access to, and I will be sending out the caviar by the end of the week as well. I do have the voiceover training that is available and has been sent to you. And that is really an extensive training that you can do in your own time. And you can stop and you can repeat, and you can play and you can write down and you can make notes. It's basically, again, a presentation that you'll see in front of you, my voice talking in the background, explaining all the products in excessive detail to you. All right, so you will get that in addition to what I'm going through with you today. And obviously, as you know, I am always available for any one-on-ones or questions, so please feel free to contact me. Okay, all right, so just to quickly share a little bit of light and a recap in Matisse's retail range. I've just made a few little notes that obviously, as you know by now, the packaging is changing. So, for example, Densité is now in a beautiful white box, all right? And when you open it, you've got the product inside, okay? And then that is your primary and your secondary packaging, because also you have a change in your actual physical packaging of your product. So as you can see as well, again, the colors is being removed out of the actual packaging, the actual containers, and it's coming in just small little flashes, color splashes, all right, on the actual product. And the diagram that you see in front of you on your screen is all the Pantones and all the colors of the ranges that are coming, and that will join us, okay? So we are going to look today just at our gray and our black, and then a little bit of our blue, and that is our global eyes. Okay. So packaging, I hope that you share my joy in the fact that they look stunning and beautiful. I have a lot of them displayed in my bathroom, and I am loving every time I look at it. I'm like, wow, you're so pretty. And that's not me in the mirror, it's the products I'm talking about. Okay. So then also with regards to the formulations are becoming cleaner and greener. Now, that is super exciting news for us, because I think as and where the industry is going at the moment globally is to cleaner, greener formulations, less carbon footprint when it comes to packaging. They're looking for removing certain active ingredients like wheat and gluten and silicones and all of that out of the products. Matisse is doing exactly that, okay? So we are removing parabens. We've looked at the way products are packaged. And to give you an indication, inside your new box of packaging, you'll see that the outside is white, but the inside is black, okay? One of the reasons for that is for light, all right? So we will reflect light away, and the dark color on the inside will, we're reflecting the light away, and the dark on the inside is preserving the quality of the products, okay, on the inside. So that's just a natural way of preserving the quality of the products and having us needing to use less parabens and preservatives, all right? We are, not that our products contain any palm oils or anything, but there's obviously a big thing on the fact that there will definitely be no traces of palm oils, mineral oils, gluten, wheat derivatives, soya bean, all stuff like that is being removed, okay? A lot of very big fancy words, all right, that are used in like perfumes and anti-preservatives and stuff being removed from Matisse's formulations. So we are most definitely looking at cleaner, greener formulas. And they come in immediately when there is a change in packaging and there is a change, obviously, in the the content of the actual product will come when there is new packaging. And that's because we need to obviously update the ingredient list and all of that on the packaging as well. So you can expect everything that is new formulation now, new packaging, will have a cleaner and greener formula. Okay, so that is super exciting. Like I said to you, we're obviously going through a change. Unfortunately, it's been a little bit slowed down because of the COVID, because of our shipments have been a little bit delayed, but hopefully, and as soon as we have, obviously, we share it with you immediately. And for now, we have just launched the new Caviar the Day cream, which is called the cream, the night, and the eyes tester. We haven't yet launched the milk and the lotion. They are coming, but we haven't yet launched them. All right. Okay. So let's get into it. Let's look at caviar. All right. So first of all, in terms of caviar, to share a couple of things with you, you will have noticed that there has been an increase in the caviar price. Okay, there are a couple of reasons for that, but they have been explained to you in our newsletter. Our reps will also talk to you about it. You can also contact me, but particularly in summary, it's partly got to do with the new packaging. It's partly got to do with luxury. It's partly got to do with positioning the premium line, the was premium line, the now caviar. Positioning caviar on a level that is now really exclusive, and it is seen as a step up to any of our other lines. Okay, it doesn't mean it changes its target market in the sense that it's still, got a specific age group that is relevant to, and it still does what it does, but it is changed to be that prestigious, ultimate luxurious. And I think with the inclusion of the serum, the scrub, and the mask that are coming later on in the year, you're definitely going to see a standout premium range that is just going to exude luxury, sophistication, results, amazing. Okay, so it's just been repositioned in the market. Okay. Obviously, caviar is still our main active ingredient that is found within this range. And I want to link now the actual effects of caviar to aging, all right, of the skin, and why it is such a crucial and such an amazing active ingredient to have in a range because of what it does. So first of all, it really mimics cellular regeneration very, very, very closely to what our human cells regenerate at. Okay. So it is a natural active ingredient. It's not artificial. It is natural, all right? It is extremely remineralizing, okay? So it's packed with antioxidants. It's packed with proteins, vitamins, trace elements, magnesium, calcium, amino acids, omega-3. It is packed with antioxidants that are going to fight free radicals. So it really is an excellent, excellent category to look at for product when we want to restructure and we want to revitalize, we want to remineralize, and we want to prevent, okay? And at the same time, not only preventing, particularly repairing. Okay, so caviar, the result is a stronger epidermal hydrolipic barrier. Now, just to break up that very long epidermal hydrolipic barrier, remember, obviously, your hydro, your water, and your oil barrier. So if you're putting on a cream with such amazing ingredients like protein to strengthen the skin, your omegas, you're going to strengthen the hydrolipic barrier. So it's going to prevent water loss, it's going to prevent dehydration, it's going to preserve the elasticity and the quality of your collagen and your elastin, and then also it can help stimulate, okay, and it will help keep those elastin and collagen fibers lubricated, right? And this will lead to an increase in suppleness, firmness, and obviously have an antioxidant protective. So in a nutshell, caviar is extremely beneficial in helping an anti-aging skin, but not only in one category, in what we call a global category. So I always like to look at the caviar range, the once previously known premium range, this caviar range as a global anti-aging range to treat all aging concerns. So it's going to help, obviously, with a whole bunch of stuff. And that's why I look at this range being particularly beneficial for clients from the ages of 35 to like 50 years of age. It's an exceptionally important category and got the best ingredients in order to control that category as a preventative method. Right. I want to also just talk to you a little bit about the caviar, the sourcing of the caviar. Okay. The sourcing of the caviar. So yes, we do get our caviar from the sturgeon fish, but it is not. So what has happened in the past, obviously with the no control over the fishing industry, they obviously really did wipe out a certain population of fish, all right? What we do and where we source our fish is obviously it's a French caviar, but it is coming from the sturgeon fish, but it is farmed, okay? So we farm it near Bordeaux, which is an area in France itself, and it is farmed in a very environmentally friendly manner. It is also farmed preserving or respecting very strict quality and purity standards, and obviously in a very humane way, like a proper, there's no bad animal cruelty or anything that is happening. It is very, very much like we eat fish, if I can say that way. We source our caviar in a very, very humane way, okay? And obviously we make sure that the purity and the quality standards of the fish are of the utmost quality so that we can make sure that the fish is obviously rich in its essential minerals and nutrients, okay? All right, so it's all controlled, it's animal friendly, and it is a very strict, respectful way in which we gain our caviar. And the reason I share this information with you is because a lot of queries come about caviar. Also, a lot of queries come around allergies regarding fish and all of that. If your client is allergic to caviar particularly, or fish particularly, yes, obviously I would either do a patch test or I would avoid it completely. But if your client is allergic to shellfish and iodine, caviar is not the same, okay? So you shouldn't have a reaction, but obviously it's always important to take respect in that way and to first do your natural patch tests and stuff like that before you proceed. But in my 8 years with Matisse, as we speak at the moment, caviar has been around for all those years, and I can promise you I have not had a single query on a reaction on caviar. Not saying it's not possible, of course, but no queries, no information, no feedback or anything on allergies. And remember, they don't just take the caviar and chuck it into the product, all right? It goes through a massive surgical cleaning process before it enters into the actual product. Okay, so that's all about caviar. So let's have a look at the actual pictures, all right, of our product and our actual product. So we're going to go through the first product, and that is the milk, okay? Now, the milk, sorry, sometimes this thing just, there we go, okay. The milk, it is obviously, the milk retains its name from premium, okay? So the name stays from premium to caviar, the cleanser stays the milk. It is still your cleanser. Will still be found in a 200 ml in retail, in a 500 ml in professional, and it will be introduced with a sample sachet, okay? Obviously, when it's phased in, these things will happen, okay? But that's quite exciting that we'll be able to have a sample sachet eventually. I think it's always important when you want to introduce somebody into a cleanser and you want to move them away from comfort cleansing oil or the foam, and you want to send them to something more beneficial for their skin. The sample sachet is an awesome addition, okay? Obviously, your main active ingredients will be the French caviar and then a damask rose. And you're still looking at the same creamy, milky texture as we did in the past with your cleanser, and effective makeup removal that is going to remove all your dirt, your makeup, your grind, your everything. And at the same time, remember the benefits of caviar is remineralizing and regenerating. So it's going to help give a youthful appearance to the skin. Remember as well with the milk, as with most of Matisse cleansers, dry hands, dry face, massage it in, then add a little bit of water, emulsify it a little bit, and then you rinse off and you remove. And you repeat, or don't repeat, you follow with your toner. Okay, and our toner is here, the essence. So this is obviously not retained its name. So previously known as the lotion, it will now be replaced with the toner called the essence. You will see this systematic change is going to happen and be phased into all of the Matisse ranges. The toners are mostly all going to be referred to as essences in the future. Okay. Still your 200 ml, still your 500 ml in professional, and also a sample sachet, which is quite cool as well. Right. So you're looking at a sublimating essence here, caviar enriched toner. And here what we are going to do, and to rewind, to take you back to what I said earlier, it is important to put this onto a cotton pad or a piece of gauze and wipe over the skin. And that, remember, is for the color, the complexion of the skin, but also to help eliminate dead skin cells, because you have contact with the product on the surface of the skin. So it'll be that mild little abrasive sort of action, okay? And that's going to help you with your color and your complexion and to exude your radiance, okay? So you'll see it does not come in a spray bottle. It comes in a dropper bottle, right? Morning and evening after the milk to complete the cleansing process, to balance the pH of the skin, prepare the skin for further treatments that are going to be absorbed. It also helps because it's got a moisture and it's a water particle. It helps your moisturizer, which is more oil-based, to attach to water to have better absorption into the skin. So often people eliminate toning out of their skincare routine. It is very detrimental when you want to rehydrate and you want to nourish, because a toner actually helps better penetration of the moisturizer because of that wet feeling on the surface of the skin, right? And after you've used your toner, you will obviously follow with your treatment products. Okay, now, excitingly, what we are going to launch is the serum. It is coming, hopefully, on our next shipment. Who knows when that will be, but we're hoping and praying that it's sooner rather than later, because I know that there are many of you that are dying on your inside core for this product, okay? And that is the serum. Super excited. It is amazing. It's a very clear type of liquid, all right? Amazing active ingredients. I will share all of that with you on a separate video maybe that I do for you. We'll have a special launch around the serum where you will get all of your amazing information. I'm not going to share it with you now because then you're just going to want to sell and you're going to bug me every day about when it's coming in. Okay, so but it's coming soon, I promise. All right, so that is the serum. And then you'll have the cream and the night cream. So the cream name has changed. In premium, it was called the day. It is now called the cream. Okay, simple, the cream, but it is still for the day. Okay, it will retain its 50 ml retail size, its 100 ml in professional, and it will still be found in a sample. Active ingredients, obviously your French caviar and your marine collagen to give you the tightening toning. Okay, so this is obviously your anti-aging moisturizer. Now, once I've gone through density, I will give you a quick little summary of when would you recommend something like the cream and the night as opposed to recommending Dansifiance or Dansifiance night. I will do that for you just now. But after 28 days, use of the cream both morning and evening, clinically proven to improve the skin, you will have a strengthened, more fortified, a skin that has regained firmness, radiance, and brightness. Remember the properties of caviar being an antioxidant, being omegas. So you're going to have nourishment, having amino acids, the skin is going to be strengthened. Remember all of that. So we are going to have a reduction in wrinkles, which is what everybody wants to hear after using a moisturizer. So a pea size of product applied every morning to the skin. Massage gently into the skin, down the neck and the décolleté. Remember to use movements that are against gravity to help with or to have less external or extrinsic aging factors. Okay. So against gravity, even a few little taps afterwards just to stimulate your microcirculation. Then we've got the night. Here you will see as well, again, the caviar, and then you will see marine glycogen. Remember, we use marine collagen and glycogen because it's stronger, the minerals and the active ingredients, than what you would get from the plant. Okay. Sorry, there is a question, so I'm just going to... Yes. So, sorry, who asked that? Is on. Izan, yes, caviar would be good for severe dryness. Sorry, there was just a question, ladies, regarding the caviar, the cream being good for dryness. Yes, absolutely, it's going to help because of its omegas, its amino acids, all its remineralizing properties. Yes, is it the thickest moisturizer that Matisse has? No, but we will get to that just now when we do the Densité range, and then we will look at a product called Olay Skin, which would be for our very, very excessive dry anti-aging skin. So I hope that answered your question, Izan. You can always add another question in just now. All right. Okay, so going back to the night, remember this is an overnight regenerating treatment. Okay, so yes, it is designed to work through your natural chronobiology process with cellular regeneration that happens at night. And here you're looking at an overnight treatment. So you put it on at night, you sleep with it, and when you wake up in the morning, you just look different. Okay, you're radiant, your skin is fortified. It is a proper global anti-aging moisturizer that works overnight to retreat, to revitalize, to refresh, and to reawaken. Sorry, we've got a little bit of background noise, so I just want to make sure that everybody is muted. All right, good. Okay. So that is the night. Then after the night, we have the eyes. Oh, sorry, going back, the eyes. French caviar, again, it also retains its name from the old premium. It is obviously your black caviar eye gel. First just needs to direct me as to exactly what you can see. You can see it's still got its black color. All right, and super exciting. Oh, such beautiful packaging. I mean, please just have an aha moment. So everybody on your own screen in your own time, just go, oh, okay, it's so beautiful. All right, so you've got your firming black caviar eye gel. It does go invisible on application and on massaging it into the skin, okay? So you will take it out with a spatula, with your ring finger, apply it to your bony contours. Remember, it is a gel, so you can apply it to the soft tissue and you can apply it over the lids. It's creams that we only apply to the bony contour. So with the gel, you can go underneath the eye, you can go over it, and this is going to give you, because of the firm active, it's going to give you like a slightly tight little pull to the eye area, and here you're going to have a firmer, smoother appearance around the eye. So it's going to hydrate, going to put back moisture, water with hydration. It's going to, with the caviar, have all of its remineralizing properties, its antioxidant properties, and with the firm active, the tighten, toning, cool effect. So it's going to help lift those saggy eyelids and brows, going to help to tighten and pull those fine lines and wrinkles. And obviously best used both morning and evening. Okay. Okay, and then I just want to draw your attention to the packaging size. It has changed from a 20 ml to a 15 ml. Okay, all right. There was a reduction in price, but because of the increase in the caviar you know, somewhere it's going to even itself out. So here in this product, you won't possibly see a massive jump in the price. Okay, all right, or a change, but you are getting less. That makes sense, marketing manager, if I explained that correct. Okay, all right. Okay, so what's going to happen in retail? All right, if we look at the next page, this is, some of it is here, some of it is coming. But if you have a look, your summary sheet, you've got the milk, it replaces the milk. You've got the essence, it replaces the lotion. You've got the cream, it replaces the day. The night replaces the night. Okay, so only two real changes there in the names. The serum is new and it's coming. Then we've got the eyes, remember the 5 ml less, okay? Then we've got the scrub and the mask, which is going to join this range to make it a full anti-aging range later on in the year. And then in professional, remember you will still have the milk, the essence, and the cream in order for you to do your treatments. Okay, all right. Okay, next, we've got response density. All right, so this is our second range for anti-aging. So when we looked at premium, we were looking at approximately between the ages of 30 to 45 years of age. You can start as early as 30. I wouldn't recommend it unless somebody needs it. 35 to 45 to 50 years of age. Remember, I give you such a broad spectrum in terms of age because everybody ages differently, as you saw earlier. So you've got to be able to use your own knowledge. Sorry, I'm not sure what's happening. It's changing by itself. So you'll look at things happening. So when the density range, I give you an age group, you're looking at about 45 to 50 years plus. Now, density, draw your name. I want to draw your attention on the word density. Density is for density. So think of dermal layer, think of density would be collagen and elastin. So this range particularly is going to focus on tightening, toning, and firming, stimulating collagen and elastin production and giving the epidermal junction a tightened, more constricted pull. So it's very good for our sagging skins. Okay. The range was previously known as intensive. It keeps its silver kind of color association, but it is obviously not the entire packaging that is silver. It is now white, but with a silver color splash. Okay, so yes, from 40, 45 years of age, that still stays the same, and particularly there to tighten, tone, firm, and comfort, and to work on a sagging skin. So if we look at the next image, you will see here what I've done is I've associated what products link with what age, okay? So as a general indication, you will look at if you are between, or if you are, oh goodness, if you are 45 years of age, all right, the wrinkles are starting to settle in, the complexion is less unified. During menopause here, your metabolism is going to slow down, the skin becomes drier, and it begins to lose elasticity and begins to become loose. So your target specific products out of your density range here, and we're going to go through them just now, but we'd be looking at Time Balance and your Dansifian serum. Okay. In the 50s, you would be looking at here, the wrinkles start to multiply, the skin becomes loose, spots become more numerous. Here you're going to look at your Dansifians, which is your Dansifians the day and the Dansifians night, and then also the Dansifians serum. And then 60 plus clients are going to be looking, or their skin is going to be drier, less refined, very saggy, lots of loss of flexibility, wrinkles and the skin is very marked. And there you would look at Olay skin and Olay signs as combinations. So this is just like a cheat sheet, if I can call it that, just to give you a rough indication of where you would go depending on what the conditions would be of the skin. Okay, so let's first look at Dansifian serum. Now, Dansifian serum contains a triple cellular action, all right, and it also contains medicines. Now, Dansifian serum is a tightening, toning, firming serum for a sagging skin. So if you are from 45 years plus, the skin has lost a lot of elasticity, you want that tightened, toned, full feeling, you're going to go, I'm sorry, I don't know why it's changing by itself. you're going to have to use the Dansifiance serum. Okay. And this, remember with serums are target-specific products that are going to treat a main concern. So it's almost like taking your prescription medication. You would always recommend a serum for your client's main concern. And that would be here a loss of elasticity. Okay. So we're still looking at a 30 ml size-wise, 30 ml tester as well, and then a sample sachet. It will not be available in professional size. Okay. And it replaces the old redensifying concentrate. Same product, obviously just improved benefits. Okay. So this is a peptide that works in synergy with your Densiderm complex, and it helps to strengthen the skin structure. That is your Dansifiance serum. Okay. Then you've got your Dansifiance. Now, your Dansifiance was your old intensive remodeling care moisturizer. It is now just called Dansifiance, but it is still your day cream for the day. Densiderm complex to tighten, tone, firm, and lift, and then also your amino acid peptide. Okay. And there you are looking at a 50 ml size, no professional, a sample, yes, professional 100 ml, and a sample sachet. Okay. And here you're looking at a day cream that helps to improve and to provide the skin with firmness, because it's going to tighten, tone, and firm, restore the skin smoothness, and help to create a visibly smoother skin. Pea-size amounts of product, morning and not evening, only morning, to the skin before or after your chosen serum. And then, sorry, I'm just letting somebody back in. And recommended, obviously, for best results for tightening, toning, and firming would be along with the Dansifiance serum. Okay. Then we have one of my favorite products. And no, it doesn't want to change. Never mind, it will come. But the next product is one of my favorites, and that is the Dansifiance Night. Okay. Dansifiance Night has also got Densiderm complex in it, and then a very firm favorite ingredient of mine is glycolic acid. And this is going to help with the restructure. So this is also an overnight treatment product, okay? And this is going to give the skin a nice enveloping texture into the skin, and it helps the skin all night long. But because of the glycolic acid, it is very awesome moisturizer to help with clients that have got a lot of extrinsic aging factors, and they've got a lot of dark marks and spots, pigmentation. Also, even that the cellular renewal process has slowed so down that the skin has become thick and leathery. This moisturizer, because of its glycolic acid, helps to give the skin a more smoother effect, and it helps to lighten pigmentation. Okay, so it's really, really, really an awesome overnight treatment. And yeah, I'm not quite 45 or 50, but I find myself levitating towards this as a nighttime product. Okay, do what I say, not what I do, but this is such an amazing moisturizer. Okay. All right, then we've got Olay Science. Now, Olay Science is a serum again, and we obviously have just launched Olay Science in its 30 ml packaging. Okay, super cool, got the most awesome little pipettes with like this super sucking rubber dropper. Very cool. Love the fact that it is now a large size of product. Okay. Still contains its active ingredients, still its crystal tear extract, its quadrant of 4 seed oils, particularly Inca Inchi, which we highlight because of its cellular regenerating properties. But Olay Science, along with Olay Skin, becomes the perfect combination of products for a very devitalized, mature skin that is dry, that is lacking in nourishment. Because Olay Science is oil-based, it does put a lot of nourishment back into the skin. But the most amazing thing about Olay Science, and it's really its key factor that we have to highlight, is the fact that it's like our time machine. And it basically turns back the hands of time when it comes to anti-aging. So it reverses the aging process and it takes us back in time, and it allows the skin to function as it did when it was younger. Now, what that means in a nutshell is that it's going to reactivate and re-stimulate clothoproteins. Clothoproteins stimulate fibroblasts in order for fibroblasts to produce more collagen and elastin. So clothoprotein feed fibroblasts. When fibroblasts have enough clothoprotein, we're going to have active fibroblasts that are going to produce collagen and elastin. So Olay Science feeds the skin with clothoproteins to stimulate and to reactivate the fibroblasts so that they can produce more collagen and elastin, so that we can have tightening, toning, firming, and a younger skin. So Olay Science is really a very technical product. You have to be able to, or you must use it consecutively for 21 to 28 days. So when you recommend this to a client, don't tell them to stop using it. And I think this is one of the biggest things of why we've increased the packaging, is because a lot of clients after a month stop using Olay Science, and they actually don't really get the full effect and benefit of Olay Science. So by doubling in size, you've obviously got double the amount of applications in your packaging. You've got longer use so that we can get better and clearer results out of Olay Science. So for the first 21 to 28 days, you must use it morning and evening. It is a serum. So after Cell Expert, you apply Olay Science and then your chosen day cream or night cream. 21 to 28 days, use it, 2 to 4 drops per application. And by that, I mean literally when you take out the packaging and you drop it, 1, 2 is sufficient for the face, 3, 4 will take it all the way down to the neck and the décolleté. Okay, right. I'm going to get rid of all the sanitizer and the negative effects of alcohol on my skin now by applying Olay Science on my hands. Okay, just because I can. All right. Okay, so it is a non-greasy, dry oil texture. So you'll even see straight afterwards, I can touch my paper, my notepads, and it doesn't even leave any fingerprints or anything. It's dry oil. It disappears. The skin absorbs it because it's water soluble as well. So it's not just an oil, it's oil and water. So actually the skin will absorb the Olay Science. Okay. And like I said, you use it consecutively for your 21 to 28 days. Thereafter, you can start dropping your application down once a day, although I wouldn't recommend it really if you want to get the best results. Okay. And then the recommended associated moisturizer with Olay Science would be the Olay Skin, which is the old resourcing cream. And that was the very thick moisturizer for your undernourished skin. Okay. So that is Olay Science. Super cool, super awesome. Love it. And let's move on to Olay Skin, which is your associated moisturizer. It's previously was known as the resourcing cream. This is our 60 plus moisturizer. Okay. Our 60 plus moisturizer, in order for this, very rich in your black pearl from Tahiti and your Inca Inchi oil, they are remineralizing ingredients. So here you're looking at your black pearl being rich in all what we call our micro elements. So your zinc, your iron, your copper, your magnesium, to give the skin a thickening. When I say thickening, we don't want to thicken up a thick skin. We want to reaffirm the skin, and we want to refortify is the word I'm looking for. And we want to re-nourish and rehydrate that skin. So this day and a night cream, so this cream you can use both morning and evening, is very velvety and it is very rich. So it is for the driest of skins. Okay, so it's really nice, very good for an undernourished skin. And this would be an anti-aging moisturizer. To answer and to go back to refer to your question, that would be for the driest of mature skins. Okay. And here you've also got the Inca Inchi, which is a very nutritive ingredient, and it helps to restore the lipid balance, the oil balance, bringing comfort and suppleness to the skin. It's going to retain its retail size, its tester size, and its sample. Okay, so this is our thickest of thick, and it was the old resourcing cream that is now known as Olay Skin. Okay. And then last, but most definitely not least when it comes to the denser tape products, and that is time balance. Thank goodness the French listened to us, and some of you would have known that this cream was going to change from revitalizing omega-3 to compensating cream, and we are very glad that that didn't happen, and it has changed to time balance. And I think time balance really does describe this moisturizer very, very effectively, because when we start, and this is our menopausal cream, it's a cream that we recommend particularly for fluctuation in hormones. In mature skin, it's associated, a change of hormones is associated when menopause comes along. Many changes happen to the skin during menopause. And again, going back to the title of the cream being time balance, I think what a menopausal person needs is a balance of holistic and peace and all of that. And time balance just really looks at the time in your life where you need this sort of balance. And I really do like the name of time balance. And what we are looking at here is during menopause, okay, there are a couple of things that are happening. First of all, there is less production and repair of your collagen and your elastin fibers in the dermis, and this leads to elastosis, which is obviously the breakdown and the loss of your elastin. Okay, you're also going to lose the supportive fats underneath the skin. We did speak about this in the aging process. You're also going to have the detachment or the loosening of the bones that are shrinking and the skin, so giving you, you know, that very loose, creepy kind of skin. Fat is moving to the abdomen, hence the reason when we hit menopause, a lot of mature ladies end up with more fatty deposits around the abdomen as they do anywhere else. So they've still got their thin legs and their arms and their beautiful figure, but all of a sudden they talk about this tire tube that they end up with around their waist. So that is just a natural phenomenon that happens during the menopausal process. Also, the blood flow to the dermal capillaries slows down, which brings about less oxygen and nutrients to a skin that is going through menopause. And we also have an impaired barrier function of the skin. So we have quite a lot of sensitivity, a lot of transepidermal water loss, so a lot of dehydration, and combined with the hormonal changes of just a general feeling of being down and, you know, not a nice feeling. Okay, all right. So when your skin looks good, you'll feel good. So time balance is really one of those moisturizers we would like to include because of its well-being complex and because of its rich saturation and its rich composition of its omega-3. Okay. And the well-being complex is actually a cocoa bean extract that is there to increase the skin's endorphin levels to bring about more oxygen and nutrients. So like a feel-good messenger to the skin, helps to relieve the tension, helps to give a smoother skin and also a more radiant skin, because basically there's an increase in energy levels with the production of endorphins that come from that cocoa bean, that well-being complex. So really nice, still recommended with a nice cup of hot cocoa and hot chocolate, or just a nice good quality cocoa chocolates. It's a really nice combination just to make you feel good. Okay, so that is time balance. So if we look in summary, Dansifiance serum replaced the old redensifying concentrate. Dansifiance replaced the intensive remodeling. Dansifiance night replaces restructuring evening. Olay Science has got new packaging. It's 15 mils more. So there is an increase in price. It's not double. So that is so amazing. We really worked long and hard to make sure that we don't insert that one at a double price. So you are getting double the quantity, but not at double the price. So that is a good selling point for Olay Science. Then we've got Olay Skin, which replaced the intensive resourcing. And then we've got Time Balance, which replaces Omega. And then Dansifiance, only the moisturizer will be available in professional size in your 100 ml. And then sadly, there is the discontinuation of the resculpting mask. and the firming and neck cream. But remember, Caviar is getting a mask, so that is going to help. And this is where I'd like to just quickly explain to you how you can interact both Caviar and Densité together. Your clients do not need one or the other. You are able to intermingle the ranges, you know, to prescribe with a little bit even of corrective and even from regard. You are allowed to mix and match. That's the beauty and the glory about Matisse. You can mix and match exactly to what your client's skin needs are. Okay, so that is, okay. Okay, there are a few questions, so I'm going to stop and just revert to Kirsty, and then I'm going to answer your questions. Yes, Izan is also a question from you. So both Caviar and Densité are both good for 60. Obviously, in your ages of 50 to 60, there is more sagging. So obviously, Densité would be slightly better in that regard because it will give you more of the tightening and toning. But Caviar is also good for the cellular regeneration. So my idea would be that you would combine. So you could add in the Dancepian serum, for example, with the Caviar the day and the night. Okay, another question. The Olay Science, the cost price of Olay Science is 1,735. The retail price of Olay Science is 2,900. Okay, that was another question. Yes, of course, all this information, remember it's being recorded, so you will get this presentation in a PDF form of the actual documents, the notes that what I'm showing you on the screen, the presentation, but then the recording of the whole presentation will be emailed to you, and you will have access to that, and you'll be able to watch it on a private YouTube channel. Yes, of course. Chantal, if you would like to unmute yourself, you can unmute yourself and then you can chat.
Morning, everybody. I just want to quickly add, you said earlier about the dry skin. With the Caviar, because it's so active, the therapist has to remember if the client has a lipid dry skin, it tends to cause a tingling sensation because of the active ingredients. So it's more anti-aging cream than a treatment cream. So they mustn't give this as a treatment cream, but more as an anti-aging cream. And then I had one more question.
Yes,
I wanted to know how much percentage is the glycolic acid?
The glycolic, they don't give us a percentage of glycolic acid per product. But it's generally probably about less than a 10% in the moisturizer, but good quality and obviously active. Does that answer your question?
Yes, thank you very much.
Okay, awesome. I just want to go back to what Chantal said there about the tingling sensation that happens with the Caviar. It can actually happen with all of our moisturizers. And the reason for the tingling sensation is because all the products are based on an acid, because that is the pH level of what we want the skin at. So how that works is obviously a lipid dry skin and a dehydrated skin is you're going to be left with cracks in the epidermis. And when you apply a product that is based on an acid and you apply that to the surface of the skin, remember we do have a certain amount of pain receptors that are very close to the surface of the skin so that we can associate heat and cold and all of that, you know, so that you don't burn yourself, for example. So when your moisturizers are applied and they are active, like 90% of Matisse's creams really are active, and very effective, you will experience a tingling sensation, and that is really because of the acid is being exposed to the cracks in the epidermis that are exposing all of our tactile and our corpuscles, okay, our nerve endings. and that's why we experience the tingling. It should go away very quickly, and obviously the more you use your moisturizers, you are going to repair that barrier of the skin, and you should have less and less tingling. Okay, right. Should never be a burn, but a tingling. Okay, so I hope I could add a little bit of clarity on that one for you. And are there any more questions for now? Okay, I've got one more product that I would just like to talk about, and then our time is going to be done and we can conclude, and that is Global Eyes. Now, Global Eyes, as you know, moved out of, it was the old repairing eye cream, and it moved out of the Densité or the then intensive range, and it is now in the eye range on its own. It is still regarded as an anti-aging eye cream. So along with the eyes that you find in Caviar, Global Eyes is still repairing eye cream, just with a new name and found in a different range. Okay, so it still contains your Alveolift, your Silk Tree, your Matrixins, your natural, 100% natural complex sugars. So not your gluten, but your other complex sugars to create a tightening, toning, cooling effect. But the most important thing about Global Eyes is that Global Eyes does 3 main effects. And those 3 main effects that Global Eye works on, it works on wrinkle formation, okay, or the anti-aging action of wrinkles. It works on your puffiness to reduce the puffiness around the eyes and underneath the eyes with a drainage. So it helps to increase the drainage of your toxins, like a detox to reduce the puffiness, and it works on dark circles. Okay, all right. So 3 main targeted effects. It's the classic anti-age, it's cream texture. So as opposed to the eyes, it's more nourishing because it's got a cream base, where the eyes is gel, so it's more tightening, toning. Here you're looking at more nourishing of deep lines, wrinkles, puffiness, and your dark circles. Okay, so Global Eyes is still the go-to eye moisturizer if you want to treat a couple of different aging concerns. Okay, so we're looking at it, the size has been reduced. I think a lot of you would have noticed that already because it has been out on the market for a while. It's reduced from a 20 ml to a 15 ml, but so did the price. So the price came down quite nicely, which is nice. And it will be coming in a sample, a sachet as well, and then it will also be coming in a professional size. So I know a lot of you for your own personal use are saying yay, yay, yay. Obviously, but it is nice, obviously, in our treatments, when we start doing our treatments again, to have this product available in our treatments. Okay, so that is Global Eyes. Are there any more questions that you possibly have or you would like to share? I see nothing yet on the chat. I think Kirsty has added a price on the chat, so you can look at the chat for a price. And if there are no more questions, I'm going to say congratulations, everybody. You have completed today's anti-aging workshop. Obviously, remember, for all of you, yes, I've issued myself a certificate. I have to, hey. You will get a certificate that looks like that on your screen in front of you, obviously with your name, not mine, only my signature, with today's date to say that you have completed this, and you can advertise this. We would also probably like to advertise the fact that you have participated in this course on our Instagram stories. So if you object to having your image, your picture, and your, not your picture of you yourself, but if you object to having your certificate displayed on our Instagram, on Matisse South Africa's Instagram story, please say so, and then we will not put yours up. But if you are okay with us doing it, then we would love to share your participation in the course. It's amazing to have you. I'm going to stop sharing my screen with you. If you would like to switch on your cameras or anything, and just so that I can see all your amazing faces, and just to say hi, that would be amazing. Hello. So if
Lisa.
you are welcome to leave. We are done. Thank you very much. It was lovely. Obviously didn't get to see you, but it was really nice. I do see some faces here that I missed so much. Precious, I see you. Danielle, I see Karen. Hi, Karen. Tanea, obviously I see you. I did see Renelle, then she switched off. Sorry, I've got two screens, so some people come and go. I see Cherise. Lovely to have you, Cherise. And yeah, it's awesome to see everybody, and I do hope that I can see you sometime soon. Don't know when, but I do hope so. But I hope you enjoyed today. And remember, we do have another course happening next week, and that is on skin aging. Listen to me, I'm stuck in the past. It is going to be skin conditions, where I am going to go through the new purity products, the new delicates. I'm going to talk about acne, how acne is formed, how do we treat it, particularly going to talk about sensitivity. We'll touch on some pigmentation. So those of you who would like to join us that haven't yet secured your spots, let us know, but we will be in contact. But I think it will also be a very informative class as well, to get you geared up and knowing what is happening, especially with the new products, and especially as this is the way training has to be for now. So we unfortunately don't have a choice. This is the only way we can do it for now. So I think it will be very informative. So let me know if you want to join us. But yeah, otherwise it was wonderful. Look forward to chatting to you guys soon. And yeah, does anybody want to say anything?
Yes, Lisa.
Yes.
Quick question. Hi, everybody. Regarding peels, are we going to see any new peels in the future? And regarding a derma pen, which products of the Matisse range one would use in your derma pen?
Okay, so with regards to new peels, we are busy, Paris International is busy with professional. So as you know now, in the past, we've just redone the whole of our retail range. We are reworking the professional range, of which there is a lot of request for peels, different peels, stronger peel, more effective, etc. So I can't tell you. I've had a workshop and things do look good, but nothing yet is cast in stone. But there is good possibility that there will be something like that in the future, but I can't be 100%. I can't tell you 100% at this stage. With regards to DermaPen, DermaPen is obviously something that Matisse doesn't supply, but we do support derma rolling, derma penning, anything of even micro, the derma planing. Those are all possibilities, aesthetic treatment type of things that you can add with Matisse. How you would use your product, obviously your essences in professional will be exceptionally beneficial in helping to provide slip with rollers and with pens and for penetration. And then obviously as retail would be your Cell Expert, Fundamental, and any of your other prescribed products that would help cellular regenerate and help whatever you're treating. So if you're looking at treating acne, you would obviously recommend the oil control range to help with the acne. But Cell Expert for cellular regeneration, for penetration is essential. And then obviously whatever else relevantly that you are treating would be what you would recommend. Does that make sense, Tanea?
Thank you. Thank you very much. Yeah,
Great.
Very informative. Thank you. Thank you
Awesome.
for today.
Great. It's a pleasure. Hope you're also all enjoying the YouTube videos and all the Instagram videos and all of that. If you haven't and you still haven't found out about our YouTube and you're still not following us on Instagram and Facebook, go and have a look. If you want videos to be sent to you personally to reshare on your pages, you know where to find me, and I will send them to you, or links to them that you can download. All right. No further questions? It was wonderful to have you. Peace out to everybody. stay watching your inbox for all the information for today. Just give us a little while because we have to convert this whole recording into something and then get a link and then upload it. So it does take a little while, but hopefully by the end of the week, you should have everything that you need. And I'm going to right away start working on your certificates. What I would like you to do before you leave the chat room is to just write your full name and surname, how you would like it to appear on your certificate for us, and just pop it in the chat section so that I can go back and I can have a look and just make sure to double check myself that I've got the right names and surnames. Thank you, everybody. It was awesome to have you, and I look forward to seeing you next week.
Thank you, Lisa.
Bye-bye.